म सञ्जिता पण्डित वेलकम गर्दैछु यहाँहरूलाई मेडिकल विथ सन्जुमा। आई होप यु अल आर फाइन र एनएनसी प्रिपरेसन राम्रोसँग गइराखेको होला। एनएनसी नेपाल नर्सिङ काउन्सिल को सेट 17 को रिमेनिङ क्वेसन नम्बर 76 ब्रेस्ट इज ऑप्शन ए इंडोक्राइन ग्लैंड, ऑप्शन बी मोडिफाइड स्वीट ग्लैंड, ऑप्शन सी डक्टलेस ग्लैंड एंड ऑप्शन डी नॉन ऑफ द एबव। Breast is modified sweet gland. Option B is right answer. Question number 77. What nursing intervention is specific for client with a cardiac problem who are in active labor? Option A, encouraging frequent voiding. Option B, monitoring the blood pressure hourly. Option C, auscultating the lungs for crackles every 30 minutes. Option D, helping to return from side to side at 15 minutes interval. Option C, auscultating the lungs for crackles every 30 minutes is the right answer. Question number 78. Harmful effects of drugs in a fetus are referred as option A, cardiogenic, option B, teratogenic, option C, lithogenic and option D, oncogenic. The right answer is option B. Teratogenic is a harmful effect of drug in a fetus. Question number 79. During the period of inductions of labor, a client should be observed carefully for sign of option A, severe pain, option B, uterine tetany, option C, prolapse of umbilical cord and option D, hypoglycemia. इंडक्शन को बेलामा केयरफुली चाहिँ कुन साइन अब्जर्भ गर्नुपर्छ? युटेराइन टेटानी, ऑप्शन बी इज राइट आंसर. क्वेश्चन नंबर 80. A nurse, the uterine fundus of a client in the immediate post-operative period. When the nurse locates the funds, she notes that the uterus feels soft and boozy. Which nursing interventions would be appropriate initially? Option A, elevate the client leg. Option B, encourage the client to void. Option C, massage the funds until it is firm. And option D, push on the uterus to assist in expressing clots. आफ्टर डेलिभरी यदि युटेरस सफ्ट एन्ड बजी फिल भयो भने कुन इन्टरभेन्सन एप्रोप्रिएट हुन्छ? मसाज गर्नुपर्छ. फन्डसलाई मसाज गर्ने, फर्म नहुनु जेलसम्म मसाज चाहिँ गरिराख्नुपर्छ. क्वेसन नम्बर 81. माइक्रोसोमिया इज ओकेजनली रिलेटेड टु अल एक्सेप्ट ऑप्शन ए मेटर्नल ओबेसिटी, ऑप्शन बी जेस्टेशनल डायबिटीज, ऑप्शन सी pregnancy and option D, maternal hypertension. दिएको कन्डिसन्सहरु मध्ये माइक्रोसोमिया सबैमा हुन्छ तर कुन कन्डिसनमा हुँदैन? मेटर्नल हाइपरटेन्सनमा चाहिँ माइक्रोसोमिया हुँदैन. मेटर्नल ओबेसिटीको केसमा माइक्रोसोमिया हुन्छ. जेस्टेशनलमा एन्ड प्रोलङ प्रेग्नेन्सीको केसमा पनि हुन्छ तर मेटर्नल हाइपरटेन्सनमा माइक्रोसोमिया हुँदैन. क्वेसन नम्बर 82. जेस्टेशनल एज इज एलिभेटेड फ्रम ऑप्शन ए क्याल्कुलेसन फ्रम LMP, ऑप्शन बी हाइट अफ द यूटेरस, ऑप्शन सी काउंटिंग फ्रम द डेट अफ ओवुलेशन एंड ऑप्शन डी काउंटिंग फ्रम द डेट अफ फर्टिलाइजेशन. जेस्टेशनल एज र EDD कसरी निकालिन्छ, कुन डेटबाट निकालिन्छ भने डिटेलमा यसको क्लास भइसकेको छ. यदि यहाँहरूले हेर्नु भएको छैन भने डिस्क्रिप्सन बक्समा गएर लिंक ओपन गरेर हेर्न सक्नुहुन्छ. यसको लिंक शेयर गरिएको छ डिस्क्रिप्सन बक्समा. जेस्टेशनल एज LMP बाट निकालिन्छ. क्याल्कुलेसन फ्रम LMP, ऑप्शन ए इज राइट आन्सर. क्वेसन नम्बर 83. A 15-year-old preemie gravida is admitted with a tentative diagnosis of HELLP syndrome Which laboratory finding is associated with HELLP syndrome? Option A, elevated blood glucose. Option B, elevated platelet count. Option C, elevated creatinine clearance. And option D, elevated hepatic enzyme. HELLP HELLP syndrome को फुल फर्म हुन्छ H बाट हेमोलाइसिस, E बाट elevated liver enzyme, low platelet count. So elevated hepatic enzyme, option D is right answer. Question number 80. The expected respiratory rate of a neonate within 3 minutes after birth may be as high as option A 50, option B 60, option C 80, and option D 100. Option B 60. Option B is right answer. Question number 85. The client visits the prenatal clinic stating she believes she is pregnant. A pregnancy test is done to detect elevated level of option A prolactin, option B human chorionic gonadotropin HCG, option C lecithin sphingolide, and option D estriol. प्रेग्नेन्ट छ कि छैन भने HCG ह्युमन कोरिनिक गोनाडोट्रोपिन हर्मोनबाट थाहा पाउँछ र यो हर्मोन नै आइडेन्टिफाई गरिन्छ। अप्सन बी इज राइट एन्सर। यो हर्मोन ब्लडमा अथवा युरिनमा दुईटैमा डिटेक्ट गर्न सकिन्छ। प्रेग्नेन्सी ब्लडमा 7 डेजमा डिटेक्ट हुन्छ है प्रेग्नेन्ट छ कि छैन, र युरिनमा 9 डेजमा डिटेक्ट हुन्छ। भन्नुको अर्थ ब्लडमा 7 डेज पछि चाहिँ HCG को लेभल इन्क्रिज हुन थाल्छ र युरिनमा 9 डेज पछि। क्वेशन नंबर 86. Initial breastfeeding is given to the newborn baby within option A 1 hour after birth, option B 3 hours after birth, option C 24 hours after birth, and option D 12 hours after birth. दिएको अप्सन मध्ये अप्सन ए इज राइट एन्सर 1 hour आफ्टर बर्थ। तर एज सुन एज पोसिबल जति छिटो हुन्छ त्यति छिटो के गर्नुपर्छ ब्रेस्ट फिडिङ गराउनुपर्छ। विदिन हाफ आवरमा नै गराउनुपर्छ। क्वेशन नंबर 87. इफ अप्सनमा विदिन हाफ आवर दिएको भए विदिन हाफ आवर हुन्थ्यो, अथवा एज सुन एज पोसिबल दिएको भए एज सुन एज पोसिबल पहिला हुन्थ्यो, त्यसपछि हाफ एन आवर, छैन भने 1 hour। Question number 87. Placenta is completely developed in option A 8 weeks, option B 10 weeks, option C 12 weeks, and option D 16 weeks. Placenta is completely developed in 12 weeks. Option C is right answer. Question number 88. Preparium is postpartum period up to option A 2 weeks, option B 3 weeks, option C 4 weeks, and option D 6 weeks. Preparium भनेको आफ्टर डेलिभरी पछिको स्टेजलाई प्रिपेरियम भनिन्छ र यो 6 weeksसम्म हुन्छ। अप्सन डी इज राइट एन्सर। क्वेशन नंबर 89. The following symptoms are related to ectopic pregnancy except option A acute abdominal pain with a history of amenorrhea, option B abdominal pains and bleeding per vagina, option C fainting attack and shoulder tip pain, option D painless continued vaginal bleeding. ectopic pregnancy को पनि लेक्चर भइसकेको छ, यसको लिंक पनि डिस्क्रिप्सन बक्समा शेयर गरिएको छ। राइट एन्सर इज ऑप्शन डी पेनलेस कन्टिन्युड भेजाइनल ब्लिडिङ। यो चाहिँ इक्टोपिक प्रेग्नेन्सी को सिम्पटम्स होइन। इक्टोपिक प्रेग्नेन्सी भनेको जुन ठाउँमा इम्प्लान्टेसन हुनुपर्ने त्यो ठाउँमा नभएर आउट अफ युटेरस मा इम्प्लान्टेसन भइदिनु कन्डिसनलाई इक्टोपिक प्रेग्नेन्सी भनिन्छ र यसको मेन साइट हुन्छ एम्पुला। जुन ठाउँमा एम्पुलामा के हुन्छ फर्टिलाइजेसन हुन्छ र एम्पुलामा नै के हुन्छ इम्प्लान्टेसन भएर त्यही ग्रोथ हुन थाल्छ बेबीको, त्यो भनेको एक्टोपिक प्रेग्नेन्सी हो। द मोस्ट कमन साइट अफ एक्टोपिक प्रेग्नेन्सी इज एम्पुला र यसको मेन सिम्पटम हुन्छ पेन। एक्टोपिक प्रेग्नेन्सीमा पेन है, टिप अफ नेलमा पनि पेन फिल भएको हुन्छ। Question number 90. The nurse working on the postpartum unit should teach clients to ambulate yearly. This is done to option A. Enhance respiration, option B. Increase bladder tonicity, option C. Strengthen abdominal muscles, and option D. Promote peripheral vasomotor activity. प्रमोट पेरिफेरल भ्यासोमोटर एक्टिभिटी है, यो बढाउनको लागि के गर्नुपर्छ, एम्बुलेट गराउनुपर्छ पोस्टपार्टम पेसेन्टलाई। क्वेसन नम्बर 91. द नर्स इज टिचिङ अ पोस्टपार्टम अबाउट ब्रेस्ट फिडिङ, विच इन्स्ट्रक्सन शुड द नर्स इन्क्लुड? ऑप्शन ए. द डाइट शुड इन्क्लुड एडिशनल फ्लूड, ऑप्शन बी. प्रीनेटल विटामिन शुड बी डिस्कन्टिन्यूड, option C. Soap should be used to clean the breast, option D. Birth control measures are unnecessary while breastfeeding. ब्रेस्टफिडिङको बारेमा टिचिङ गर्दा पोस्टपार्टम ओमेनलाई भने एडिसनल फुड खानुपर्छ है, डाइट चाहिँ मेन्टेन गर्नुपर्छ भन्ने चाहिँ इन्स्ट्रक्सन दिनुपर्छ। ऑप्शन ए इज राइट आन्सर। Question number 92. A client in a prenatal labor 31 weeks who is dilated in 4 cm has been started on a magnesium sulfate and contractions has stopped. If the client's labor can be inhibited for the next 8 hours, the nurse anticipates a prescription of which medication? Option A. Nalbuphine, option B. Betamethasone, option C. RHD immunoglobulin, option D डिनोप्रोस्टन भेजाइनल इन्सर्ट। केसमा चाहिँ बेटामेथासोन दिनुपर्छ। ऑप्शन बी इज राइट आन्सर। क्वेसन नम्बर 93. इन विदिन द फर्टिलाइज्ड ओभम इज इम्प्लान्टेड इन द युटेराइन वाल, ऑप्शन ए 12 आवर, ऑप्शन बी 24 आवर्स, ऑप्शन सी 4th डे एन्ड ऑप्शन डी 6th डे। Within 6 days, option D is right answer। र इम्प्लान्टेसन कम्प्लिट हुन्छ 11 to 12 डेजमा। क्वेसन नम्बर 95. यदि 6th को ठाउँमा 5 to 6 दिएको भए 5 to 6 आन्सर हुन्थ्यो र इफ आन्सरमा अप्सनमा चाहिँ 5 पनि छ र 6 पनि छ, त्यतिखेर 6 हुन्छ। क्वेसन नम्बर 94. The registered nurse is making assignment for the day, which client should be assigned to the pregnant nurse? Option A. The client receiving linear accelerator radiations for lung cancer. Option B. The client with a radium implant for cervical cancer. Option C. The client who has just been administered soluble brachytherapy for thyroid cancer. Option D. The client who returned from placement of radium seeds for prostate cancer. The right answer is option A. The client receiving linear accelerator radiation for lung cancer. Question number 95. Breast milk is baby first immunization. Antimicrobial factor present in breast milk is option A. macrophage, option B. secretory IgA, option C. lysosome, and option D. all of the above. Breast milk is a baby first immunization or it is a natural active immunity and it contains all macrophage, secretory IgA, lysosome, all of the above. Option D is right answer. Question number 96. Which family planning method is permanent method? Option A. barrier method, option B. hormonal method, option C. sterilization method, and option D combined method. Sterilization method is the permanent method. Barrier method, hormonal method and combined method is a temporary method. Option C is right answer. Question number 97. The nurse is differentiating between cephalohematoma and caput succedaneum. What adaptation is unique to caput succedaneum? Option A, scalp over the area is tender. Option B, edema cross the suture line. Option C, edema increase during the first day. Option D, scalp over the area becomes ecchymosed. Option B, edema cross the suture line. यो चाहिँ caput succedaneum मा मात्र हुन्छ. Option B is right answer. यो बाट नै cephalohematoma हो कि caput succedaneum हो भन्ने चाहिँ डिफरेन्शिएट गर्न सकिन्छ. Question number 98. Which is the organ of a dual origin? Option A, fetus. Option B, umbilical cord. Option C, walk sac and option D, placenta. Placenta is a dual organ. Option D is right answer. Question number 99. Following conditions are responsible for nipple discharge except option A, hyperprolactinemia, option B, lactation, option C, duct ectasia and option D, mechanical stimulation. Possible causes of nipple discharges are like abscess, birth control pills, breast infection, excessive breast stimulation, endocrine disorder, lactation. These all are stimulate for nipple discharge except duct ectasia. Option C is right answer. Duct ectasia लाई mammary duct ectasia पनि भनिन्छ and it is a begin, that means non-cancerous हो यो. Breast conditions. This can cause the duct to become blocked and lead to fluid build up. Question number 100. Principal blood values during pregnancy are all except option A, blood volume rise by 40%, option B, plasma volume rise by 50%, option C, red cell volume rise by 20%, option D, hematocrit rise by 10%. Option D, hematocrit rise by 10% यो चाहिँ हुँदैन. Question number 101. The main disadvantage of autocratic leadership is option A, it can increase efficiency, option B, it helps to get a quick result, option C, it is helpful for a few employees and option D, it has a one-way communication. Leadership style तीन किसिमको हुन्छ, autocratic, democratic and laissez-faire. Autocratic is a one-way communication. यसमा लिडरले डिसिजन लिन्छ, इम्प्लोयीलाई इन्भल्भ गरिदैन. डेमोक्रेटिकमा बोथले बसेर डिसिजन लिन्छ, सबैको सल्लाह अनुसार चाहिँ यसमा काम हुन्छ. लेजर फेयरमा ओन्ली इम्प्लोयी इन्भल्भ भएको हुन्छ, लिडरले जस्ट मेटेरियल प्रोभाइड गरेको हुन्छ. Autocratic leadership को main disadvantage हुन्छ, it is a one-way communication. Option D is right answer. Question number 102. Which is not the good character of supervisor? Option A, honesty, option B, dominant, option C, competent and option D, courageous. Dominant is not a good character of supervisor. Option B. Question number 103. Assignment means option A, only the head nurse can do it, option B, providing certain duties to personal concerned in a situation, option C, providing quality care and option D, providing education to students. Assignment means providing certain duties to personal concerned in a situation. Option B is right answer. Question number 104. The ICN was founded in option A 1898, option B 1899, option C 1900, option C 1902. INC भनेको इन्टरनेसनल काउन्सिल अफ नर्स। अप्सन बी 1899 मा चाहिँ भएको थियो र यो चाहिँ जेनेभा स्विजरल्यान्डमा छ। इट वाज द फर्स्ट इन्टरनेसनल अर्गनाइजेसन अफ हेल्थ केयर प्रोफेसनल। हेल्थ केयर प्रोफेसनलमा फर्स्ट भनेको चाहिँ यही हो। फर्स्ट इन्टरनेसनल अर्गनाइजेसन अफ हेल्थ इज अ ICN इन्टरनेसनल काउन्सिल अफ नर्स र यो 1899 मा स्थापना भएको थियो जेनेभा स्विजरल्यान्डमा। क्वेसन नम्बर 105 व्हिच अफ द फलोइङ पोजिसन इज प्रिफर्ड फर क्लाइन्ट विथ अ हाइपोभोलेमिक शक? अप्सन ए सुपाइन, अप्सन बी सेमी फ्लावर पोजिसन, अप्सन सी सुपाइन विथ अ 15 डिग्री लेग एलिभेटेड, अप्सन डी प्रोन पोजिसन। Option C supine with 15 degree leg elevated is right answer. Question number 106 which of the following is not the element of a grand plan? Option A procedure, option B communication, option C policy and option D program. Grand plan मा procedure, policy र program आउँछ, communication आउँदैन। Question number 107 which is the appropriate positions for giving enema? Option A lithotomy position, option B knee chest position, option C Sims position and option D dorsal recommend position. Enema मा Sims position maintain गर्नुपर्छ, option C. Question number 108 plan for allocation of resources on the basis of a forecasted need for proposed activities over a specific period of time. Option A budget, option B capital, option C cost and option D salary. Budget, option A is right answer. Question number 109 humidified oxygen is administered to patient to prevent from? Option A dehydration, option B halitosis, option C respiratory tract infection and option D irritations to respiratory passage. Irritation to respiratory passage irritation बाट चाहिँ प्रिभेन्ट हुनको लागि ह्युमिडिफाइड गर्नुपर्छ अक्सिजनलाई। ड्राई अक्सिजन दिनु हुँदैन, कहिले पनि कुनै कन्डिसनमा दिनु हुँदैन। क्वेसन नम्बर 110 which of the following is not the communication barrier? Option A physiological, option B economical, option C cultural and option D environmental. Economical is not the communication barrier, option B is right answer. Question number 111 most common cause in psychiatric is? Option A genetic cause, option B psychological cause, option C sociological cause and option D personal cause. It's a genetic cause. The most common cause in psychiatric genetic, option A is right answer. Question number 112 mental health is defined as? Option A psychological well-being or adequate adjustment, option B dependent on others, option C no sense of optimism, option D community unaccepted standards of behavior. Mental health is defined as a psychological well-being or adequate adjustment, option A is right answer. Question number 113 the principle of psychiatric nursing is? Option A to change consistency in the attitudes of a healthcare provider, option B to change patient behavior by rational interpretations and not through emotional experience, option C to use physical and verbal force as much as possible, option D to reassure patient in subtle and acceptable manner. The principle of psychiatric nursing is to change consistency in the attitudes of a healthcare provider. Option A is right answer. Question number 114 symptoms associated with digitalis toxicity include? Option A anorexia and nausea, option B dizziness and insomnia, option C pinpoint pupil and blindness, Option D, itching, skin and rashes. Anorexia and nausea. The first mouse. Option A is right answer. Question number 115. The nurse recognizes which factor in the post-operative client poses the greatest risk for the development of pulmonary embolism and must be addressed in the client's care plan. Option A, immobility. Option B, infrequent coughing and deep breathing. Option C, varicose vein. And option D, lower extremity edema. Immobility is the right answer. Question number 116. A 38-year-old woman returned from a subtotal thyroidectomy for the treatment of hyperthyroidism. Upon assessment, the immediate priority that the nurse would include is option A, assess pain. Option B, assess for neurological status. Option C, assess fluid volume status. Option D, assess for respiratory distress. फर्स्ट में जहाँ पनि जुनसुकै कन्डिसनमा रिस्पिरेटरी चाहिँ एसेस गर्नुपर्छ. एसेस फर रिस्पिरेटरी डिस्ट्रेस. अप्सन डी इज राइट आन्सर. क्वेसन नम्बर 117. द नर्स रिकग्नाइज विच फ्याक्टर इन द पोस्ट अपरेटिभ क्लाइन्ट. यो चाहिँ सेम क्वेसन हो अघिको जस्तै इमोबिलिटी. क्वेसन नम्बर 118. द फिजिशियन्स अर्डर्स अ paracentesis. How should the nurse instruct the client to prepare for the radiograph? Option A, void before the procedure. Option B, a laxative the evening before procedure. Option C, nothing by mouth 8 hours before procedure. Option D, a low soap source enema the morning of the procedure. Paracentesis means removal of fluid from the peritoneal cavity. इसमा void before the procedure. Option A is right answer. Question number 119. Which of the following signs are most typical of ulcerative colitis while assessing the patient's bowel elimination? Option A, constipation. Option B, bloody diarrheal stools. Option C, steatorrhea. Option D, alternating periods of constipations and diarrhea. अल्सरेटिभ कोलाइटिसमा ब्लडी एन्ड डायरियल स्टूल चाहिँ हुन्छ. अप्सन बी इज राइट आन्सर. क्वेसन नम्बर 120. द नर्मल अम्बिलिकल कॉर्ड इज कम्पोज्ड अफ ऑप्शन ए 2 आर्टरीज एंड 1 vein. ऑप्शन बी 2 veins and 1 artery. ऑप्शन सी 2 arteries and 2 veins. ऑप्शन डी none of the above. ऑप्शन ए 2 arteries and 1 vein is right answer. 4 मन्थसम्म 2 आर्टरी एन्ड 2 भेन हुन्छ. बट आफ्टर 4 मन्थ एउटा राइट भेन चाहिँ डिसिपेट भएर जान्छ र 2 आर्टरी एन्ड 1 भेन चाहिँ बाँकी हुन्छ. क्वेसन 121. इफ द पर्सन डेभलप्स हाइपोग्लाइसेमिया द प्रायोरिटी नर्सिङ इन्टरभेन्सन इज टु. ऑप्शन ए, गिभ इन्सुलिन. ऑप्शन बी, गिभ. ऑप्शन सी, गिभ लो कार्बोहाइड्रेट डाइट. ऑप्शन डी, नोटिफाई द फिजिशियन. हाइपोग्लाइसेमिया छ भने चाहिँ अर्गान जुस दिनुपर्छ. ऑप्शन बी इज राइट आन्सर. क्वेसन नम्बर 122. व्हिच वन इज स्ट्रङ्गेस्ट, थिकेस्ट एन्ड लार्जेस्ट बोन अफ आवर बडी? ऑप्शन ए, अल्ना. ऑप्शन बी, फेमर. ऑप्शन सी, क्लाविकल एन्ड ऑप्शन डी, फिबुला. Option B, femur is the strongest, thickest and largest bone of the body. Clavicle bone लाई ब्युटी बोन पनि भनिन्छ. हाम्रो बडीको सबभन्दा सानो बोन एयरमा हुन्छ, स्टेप्स. क्वेसन नम्बर 123. A female client who is paralyzed on the left side has been receiving physical therapy and attending teaching sessions about safety. Which behavior indicates that the client accurately understands safety measures related to paralysis? Option A, the client lifts the side rail down. Option B, the client uses a mirrors to inspect the skin. Option C, the client only after being reminded to do so. Option D, the client hangs the left arm over the side of the wheelchair. The client uses a mirror to inspect the skin. Option B is right answer. Question number 124. The camp nurse asks the children preparing to swim in the lake if they have applied sunscreen. The nurse reminds the children that chemical sunscreens are most effective when applied at which time? कुन टाइममा चाहिँ सनस्क्रिन क्रिम लगाउनु पर्छ इफ स्विमिङ गर्नु छ भने? Option A, immediate before swimming. Option B, 5 times before exposed to the sun. Option C, immediately before exposed to the sun. And option D, at least 30 minutes before exposed to the sun. Sunscreen स्विमिङ गर्नुभन्दा अगाडि 30 मिनट्स अगाडि चाहिँ अप्लाई गर्नुपर्छ. Option D is right answer. Question number 125. A client is undergoing fluid replacement after being burned in 20% of her body 12 hours ago. The nursing assessment relieves of blood pressures of 90 by 50 mm of Hg, pulse rate of 110 beats per minute, and urine output of 20 ml over the past hour. The nurse reports the finding to the healthcare provider SCP and anticipate which prescription. Option A, transfusions 1 unit of packed red blood cell. Option B, administering diuretics to increase the urine output. Option C, increasing the amount of intravenous IV lactate ringer solutions administered per hour. Option D, changing the IV lactate ringer solutions to one that contain 5% dextrose in water. बर्न केस दिएको छ र बर्न केसमा जहिले पनि आरएल चाहिँ युज गर्नुपर्छ. Option C is right answer. Question 126. A client is admitted to the hospital with the diagnosis of being prophylactic hyperplasia and a transurethral resection of the surgery. The nurse takes the client vital sign and empty the urinary drainage bag. Which assessment finding indicators that need to notify the healthcare provider? Option A, red blood urine. Option B, pain related as 2 on 1 to 10 pain scale. Option C, urinary output of 200 ml higher than intake. Option C, blood pressure 100 by 50 mm of FSG, pulse 130 beats per minute. Option D is right answer. Question 127. If the persons develop hypoglycemia, the priority nursing intervention is to: Option A, give insulin. Option B, Option C, give low carbohydrate diet. And Option D, notify the physician. यो क्वेशन आइसकेको हो. Question 128. A client with a chronic renal failure has been receiving erythropoietin. Which life finding indicates the medications is having its desired effect? Red cell count above 47 lakh. Option B, white cell count above 8,000. Option C, neutrophil count of 5,500. Option D, platelet count of 2,50,000. The right answer is option A, red cell count of 47 lakh. Normal value हुन्छ RBC को 4.2 to 5.4 million. Question number 129. The best management of laryngitis is: Option A, NSAID. Option B, betadine gargle with voice rest. Option C, antibiotic. And Option D, steroid. The best management of laryngitis is betadine gargle with voice rest. Rest हुन्छ यहाँ. Option B is right answer. Question 130. Which clinical indicator should the nurse expect a client with an exacerbations of multiple sclerosis to experience? Option A, double vision. Option B, resting tremors. Option C, flaccid paralysis. And Option D, mental retardation. Multiple sclerosis It is a potentially disabling disease of the brain and spinal cord, central nervous system मा चाहिँ यो पर्छ. Double vision is the right answer. Question 131. The nurse should plan to implement which interventions in the care of a client experiencing neutropenia as a result of chemotherapy? Option A. Restrict all visitors. Option B. Restrict fluid intake. Option C. Teach the client and family about the need for hand hygiene. Option D. Insert an indwelling catheter to prevent skin breakdown. केमोथेरापीले गर्दा न्युट्रोफिल्सको भ्यालुज डिक्रिज हुन्छ र यदि न्युट्रोफिल्स डिक्रिज भयो भने चाहिँ इन्फेक्सन हुन्छ र इन्फेक्सनबाट बच्नको लागि ह्यान्ड हाइजिन इज द मोस्ट इम्पोर्टेन्ट. क्वेसन नम्बर 132. During the admission assessment of a client with advanced ovarian cancer, the nurse recognizes which manifestations as typical of the disease? Option A. Diarrhea. Option B. Hypermenorrhea. Option C. Abnormal bleeding. Option D. Abdominal distension. Is abdominal distension. Option D is right answer. Question number 133. While giving care to a client with an intestinal cervical radiation implant, the nurse finds the implant in the bed. The nurse should take which initial action? Option A. Call the healthcare provider (HCP). Option B. Reinsert the implant into the vagina. Option C. Pick up the implant with a gloved hand and flush it down the toilet. Option D. Pick up the implant with a long handled forceps and place it in a lid container. Option D is right answer. Question number 134. How do you position a client with a left hip fractures in box traction? Option A. Head of bed raised at 45-degree angle. Option B. Left calf on a pillow from knee to ankle. Option C. Position the left on affected side with a pillow between legs. Option D. Positions the left in centers of the bed with the leg extended. Option B is right answer. Question 135. The nurse should include which of the following client preventions of rapid progressions of osteoporosis? Option A. Avoid taking skim milk. Option B. Avoid taking protein-rich foods. Option C. Avoid calcium supplement. And option D. Avoid alcohol. Option D. Avoid alcohol is right answer. Question number 136. Which type of exercise should the nurse recommended to CND? CINDY हुन्छ यहाँ. Option A. Jogging. Option B. Swimming. Option C. Bicycling. Option D. Skating. Swimming is the right answer. Question number 137. The nurse would instruct the patient which of the following to minimize complications? Option A. Drinking a minimum of 3000 ml of fluid per day. Option B. Eating a minimum of 2500 calories per day. Option C. Walking at least 3 per day. And option D. Resting at least 3 hours per day. Option A is right answer. Drinking a minimum of 3000 ml of fluid per day. Question 138. A client is brought to the emergency room with compound femur fracture. What is the first actions the emergency room nurse should do? Option A. Cover the open wound. Option B. Check the client blood pressure. Option C. Assess the client neurological status. And option D. Prepare the client for X-ray. Check the client blood pressure. Option B is right answer. Question 139. Which is the complication of rhinitis? Option A. Sinusitis. Option B. Headache. Option C. Malignancy. And option D. Eye infection. Sinusitis is the complication of rhinitis. Option A is right answer. Question 140. The nurse manager is observing a new nursing graduate caring for a born client in protective isolation. The nurse manager intervenes if the new nursing graduate plans to implement which unsafe component of protective isolation technique? Option A, using sterile sheath and line. Option B, performing street hand washing technique. Option C, wearing gloves and gown only when giving direct care to the client. Option D, wearing protective including a mask, cap, shoes cover, arms and plastic apron. Wearing gloves and gown only when giving direct care to the client. Option C is right answer. Question 141. An adult client was burned in an explosion. The nurse initially affected the client's entire face, interior half of the head, and upper half of interior torso, and there were circumferential burns to the lower half of both arms. The client cloth caught on the fire and client ran, causing subsequent burn injury to the posterior surface of the head and the upper half of the posterior torso. Using the rule of 9, what would the burn injury? Option A 80%, option B 36%, option C 24% and option D 48%. यो क्वेसन योभन्दा पहिलाको सेटमा आइसकेको क्वेसन हो। यहाँहरूले चाहिँ गर्न सक्नुहुन्छ। यसको एन्सर कति पर्सेन्ट हुन्छ प्लिज कमेन्ट बक्समा चाहिँ यसको एन्सर दिनु होला। क्वेसन 142. Nurse April is caring for a client who underwent a lumbar laminectomy 2 days ago. Which of the following findings should the nurse consider abnormal? Option A, more back pain than the first post-operative day. Option B, paresthesia in the dermatomes near the wounds. Option C, urine retentions or incontinence. Option D, temperature of 99.2 degree Fahrenheit. Urine retentions or incontinence. Option C is right answer. Question 143. The nurse obtains a specimen from a clear fluid that is draining from the client's nose. To determine whether this fluid is a mucus of cerebrospinal fluid (CSF), it should be tested for. Option A, pH level. Option B, specific gravity. Option C, glucose and option D, microorganism. ग्लुकोज टेस्ट गर्नुपर्छ। ऑप्शन सी इज राइट आंसर। क्वेश्चन 144. द साइकेट्री डिपार्टमेंट of Beer Hospital was shifted to Lagankhel, Patan, as present mental hospital Patan is. Option A 1980 AD, option B 1986 AD, option C 1988 AD and option D 1985 AD. बीर हस्पिटललाई लगनखेल भनेको चाहिँ मेन्टल हस्पिटलमा चाहिँ शिफ्ट गरिएको छ। कति सालमा शिफ्ट गरिएको छ भन्दाखेरि यसको हुन्छ 1985 एडी मा चाहिँ शिफ्ट भएको हो। बीर हस्पिटलको स्थापना 1947 मा भएको छ। क्वेशन नम्बर 145. A client with an inflamed sciatic nerve is to have a conventional transcutaneous electrical nerve stimulation device applied to full nerve pathway when operating the TENS. Which nursing action is appropriate? Option A, maintain the seating programmed by the healthcare provider. Option B, turn the machines on several times a day for 10 to 20 minutes. Option C, adjust the dials on the unit the client states the pain is relieved. And option D, apply the color coded electrodes on the client of where they are most comfortable. Right answer is option C. Question number 146. A nurse is caring for a client who has a paraplegia as a result of a spinal cord injury. Which rehabilitation plan will be most effective for this client? Option A. Arrangement will be made by the client and the client's family. Option B. The plan is formulated and implemented yearly in the client's care. Option C. The rehabilitation is minimum and short term because the client will return to formal activities. Option D. Arrangement will be made for a long term care because the client is no longer capable of self care. Arrangement will be made for long-term care because the client is no longer capable of self-care. Option D is right answer. Question number 147. What is the basic concept associated with the rehabilitation that the nurse should consider when formulating discharge plans for the clients? Option A. Rehabilitation needs are best met by the client's family and the community resources. Option B. Rehabilitation is a specialty area, unique method for the meeting client's need. Option C. Immediate rehabilitation needs are exhibited by the clients with health problems. Option D. Clients who are returning to their usual activities following hospitalizations do not require rehabilitation. Immediate rehabilitation needs are extended by the client with a health problem. Option C is right answer. Question number 148. What is the first action a nurse should take before administering a tube feeding to an infant? Option A. Irrigate the tube with the water. Option B. Offer specified to the infant. Option C. Slowly install 10 ml of a formula. Option D. Place the infant in the birth position. Option B is right answer. Question number 149. A nurse is teaching a parent how to prevent accidents while caring for a 6-month-old infant. What ability should be emphasized about the infant's motor development? Option A. Sit position. Option B. Roll position. Option C. Crawl distance. And option D. Stands while holding on the furniture. Rolls over. Option B is right answer. Question 150. A parent and 3-month-old infant are visiting the Well Baby Clinic for a routine examination. What should the nurse include in the accident prevention teaching plan? Option A. Remove a small object from the floor. Option B. Cover the electric outlets with the safety plugs. Option C. Remove toxic substance from the low area. Option D. Test the temperatures of the water before bathing. Test the temperatures of the water before bathing. Option D is right answer. यदि यहाँहरूलाई NNC प्रिपरेसन क्लासबाट केही सिकिराख्नु भएको छ, केही बेनिफिट भएको छ भने च्यानललाई सब्स्क्राइब, लाइक एन्ड शेयर गर्न नबिर्सनुहोला। यदि कुनै त्रुटिहरू अथवा कुनै सुझावहरू छ भने कमेन्ट बक्सद्वारा चाहिँ दिन सक्नुहुन्छ। बेस्ट अफ लक टु अल। थ्यांक यू सो मच।